The U.S. Department of Justice has taken a significant step by filing a lawsuit against the Inland Empire Health Plan, IEHP, accusing the organization of submitting fraudulent claims to the Medi-Cal program. This legal action raises serious concerns about the integrity of healthcare funding and the accountability of health insurers. According to the allegations, IEHP is accused of misappropriating funds and improperly retaining over $320 million in federal financial support. The lawsuit claims that the organization established deceptive incentive programs and misled state officials regarding its expenditures. This situation is particularly alarming as it touches on the very foundation of the Medicaid system, which is designed to provide essential health services to vulnerable populations. The California Department of Justice initiated this lawsuit on September 17, asserting that IEHP violated the Federal False Claims Act. This act is crucial in maintaining the integrity of government-funded programs by penalizing those who submit false claims. IEHP has a contract with California's Department of Healthcare Services to deliver health services to residents in San Bernardino and Riverside counties through the Medi-Cal program, which is California's Medicaid initiative. Acting United States Attorney Bill Essayli emphasized the importance of this lawsuit, stating, "Today's lawsuit against IEHP shows our steadfast commitment to hold accountable insurers that brazenly compromise the Medicaid system. We will take every measure to restore integrity and accountability to the Medicaid system and ensure that patient care, not financial gain, is the primary focus of our healthcare system." In response to these serious allegations, IEHP has firmly denied any wrongdoing. The organization expressed its disagreement with the DOJ's claims and is prepared to defend its actions in court. Winston Chan, an attorney representing IEHP from the law firm Gibson, Dunn, Crutcher, LLP, described the lawsuit as unfounded. He argued that the federal government is attempting to challenge Medi-Cal health benefits that were paid out years ago, which had been previously disclosed and approved by regulators. Chan characterized the allegations as a misguided attempt to rewrite history, asserting that they are not only factually incorrect, but also particularly troubling given the federal government's broader criticisms of state Medicaid funding. Chan also pointed out a notable absence in the lawsuit. The state of California did not join the federal government as a plaintiff. He highlighted that the lawsuit does not claim that IEHP or its staff retained any of the questioned funds, or that the providers serving California's most vulnerable populations failed to receive the full amount they were entitled to. We look forward to taking this case to court and exposing the mistaken assumptions, flawed reasoning, and false conjecture that is rife throughout the allegations, and ensuring that our client is not distracted from its not-for-profit mission to heal and inspire its 1.5 million underserved members in Riverside and San Bernardino counties, Chan stated. The crux of the lawsuit revolves around the assertion that IEHP submitted false statements to Medi-Cal and knowingly kept overpayments. Following the expansion of Medi-Cal in 2014, the federal government fully funded the program for its first 3 years. Under the terms of its contract with state officials, IEHP was required to spend at least 85% of the funds on allowable medical expenses. If it failed to do so, the health plan was obligated to repay the state the difference between the required spending and its actual expenditures, which the state would then return to the federal government. The DOJ's statement outlines that IEHP allegedly devised schemes to misuse surplus Medi-Cal expansion funding, which can be categorized into two main types: sham incentive programs and unauthorized retroactive rate increases. Prosecutors claim that the organization misallocated funds for inappropriate purposes, including administrative costs and giving away federal funding without providing any value in return. The complaint further alleges that IEHP was driven by a desire to preserve its other funding, thereby enriching itself. It accuses IEHP officials of deceiving the state through false statements, which they knew would be communicated to the federal government, regarding the nature, timing, and purpose of payments made to providers. Ultimately, the lawsuit claims that IEHP wrongfully retained at least $320 million in federal funding that should have been returned. Deputy Assistant Attorney General Brenna Jenny underscored the importance of the services provided by Medicaid, stating, "Today's complaint demonstrates our continued commitment to protect the integrity of the Medicaid program and the taxpayer dollars that support it, from health insurers that knowingly seek to divert program funds for their own financial benefit." This unfolding legal battle raises critical questions about the accountability of healthcare organizations and the safeguarding of public funds. As this case progresses, it will be interesting to see how the court addresses these serious allegations and what implications it may have for the future of Medicaid funding and oversight. What are your thoughts on the allegations against IEHP? Do you believe that health insurers should be held to stricter standards when it comes to managing public funds? Share your opinions in the comments.